Hello, my name is Dr. Elizabeth Mason. I'm a member of the academic team at the School of Health Sciences. Today we're going to have a look at what we mean by the term values and why values are important for healthcare. So the first thing we're going to do is explore the meaning of the key terms used to indicate values. So we need to understand, what do we actually mean by the term values? We need to think about what we mean by the word compassion, and why is compassion necessary for healthcare? We also need to explore intelligent kindness and how this is fundamental for the delivery of care in any of the healthcare professions. So what does the word value mean to you? Now, I'm not going to read out this long quote because it's virtually meaningless. It's so complex, it doesn't really make sense. So in simple terms, the word value is what a person feels is desirable, what they think is desirable, and the actions that come from those thoughts and feelings. So it's what we consider to be right. It's how our religion, our family, our social environment has created it within us, the values that we feel are important. Now, values can change over time and they develop over time. So what was considered to be a core value maybe 100 years ago, or even 50 or 10 years ago, may change over time. So there is a link where you can have a look at compassion in practice, and I think that's something really important. If you're thinking of applying for any of the health professions, it's important that you do look and do some work around understanding what these core words mean. So why are values important? Well, a value influences your beliefs. Your beliefs influence the way that you feel about things. How you feel about something then influences your attitudes towards something or towards a group of people, for example. Your attitudes guide and influence your actions and how you prioritise or how you actually act in a certain way, so your behaviours. Now, for healthcare professionals, if you think about this, having the right values is important. If they're going to influence our professional behaviour, then we need to make sure that we've got the right values. If they're going to influence our beliefs, our feelings, our actions, and how we behave towards people, then that's really important, because the outcome of this is the impact on the quality of care. How people perceive the quality of care, how people feel cared for, how people themselves feel valued as individuals. In healthcare, we talk about person-centred care. So that's why values are important, because we need to understand what's important for different people of different beliefs, different faiths, different cultures, and look at how our values and our beliefs influence how we act towards other people, so that we can be sure that the quality of care is as we would expect it to be. So let's move on to compassion. So the Oxford English Dictionary says that the word compassion comes from compati, meaning to suffer with. So it's not just about understanding or feeling what a person's doing, but it's being moved to do something to try and help them. When we hold our interviews, we ask applicants about, what do we mean by the term empathy, or what do we mean by the term compassion? And what will tend to happen is, if we ask somebody, what do we mean by the term compassion, they will say, well, it's empathy. So what's empathy? Well, it's compassion. So what do these words actually mean? So it's a feeling that arises in witnessing another's suffering, and that motivates that desire to help. So empathy is trying to understand what that person feels, but compassion is that motivation to act. And that is sort of the difference between empathy and compassion. You could be walking along the road and maybe seeing somebody who's sat and they are busking or begging or selling the big issue, and you think, oh, that's awful, it must be really hard to be homeless. But then compassion is actually being moved to do something to try and help that person in whatever way that you can. So if we think about the attributes of compassion, so we need to think about our relationships are based on empathy. So if we are delivering person-centred care in any of the professions, then we need to be able to have the ability to try and understand how other people feel. I mentioned the words intelligent kindness. Now, intelligent kindness is trying to be able to understand how people feel, but having the knowledge, the competence and the core values to be able to act in such a way that is right for that particular person. It's about having sensitivity to other people's emotions and recognising they need help. People won't often say that they need help. You have to recognise through their body language, maybe through what they're not saying, that a person needs help and support. So sympathy is showing concern for another person's suffering. Empathy then is that step further, being able to put yourself in another person's shoes and actually see it from their perspective. There's nothing worse, I suppose, in healthcare when somebody tells you something and you say, oh, I know when that happened to me. Rather than listening and trying to put yourself in their position, not saying how you felt about it, by understanding how they are feeling. So we said compassion is this motivation to actually act on your feelings. So it's about coming into healthcare professions or some of the other professions and actually being motivated to try and help people in their health, their well-being. Part of compassion is actually resilience, and it's being able to tolerate difficult emotions felt by yourself without being overwhelmed about them. If you look at the literature, there's an awful lot written now about resilience and what this means. And I suppose in the most simple terms, it's about being able to manage your own emotions, recognise your own emotions, be mindful of how you're feeling and actually dealing with those emotions so that you can continue to be compassionate. We talk about sort of compassion fatigue because I think when you're working in healthcare, it is about giving. You give a lot of yourself. And don't get me wrong, you do actually gain a lot from working in healthcare. You know, it writes upon you as a person. It makes you a person who becomes a healthcare professional first and foremost. So distress tolerance or resilience is really important part of compassion. Non-judgmental positive regard is the ability to remain accepting and tolerant towards another person, even when their condition, the way that they act, gives rise to difficult feelings in yourself. I think one of the most difficult things in healthcare is to actually treat another person who you don't respect their values or you don't understand their values, and you have to treat them in exactly the same way as a person whose values or ways of behaving you would understand. And that can be very difficult again, and it's a way that you have to think and reflect upon your values and how maybe you need to try and reconcile a different way of accepting other people who you would maybe encounter in a healthcare profession. So the difficulty around compassion, I suppose, is that we can be compassionate with our friends, our family. As a healthcare professional, you have to show compassion to who are essentially perfect strangers. So it's not only those you're attached to, but it's the people that you don't know and that you don't have a relationship with. And you have to be able to try and understand their thoughts, their feelings and their ways of behaving so that you can deliver compassionate care. So why is it needed? Well, it's needed more than ever because of the fact that we have an increasingly complex health system. We have an increasing use of technology to deliver healthcare. We have a science, we talk about a science of nursing, a science of healthcare, and it's driven by a technical rationality which means that we have clinical guidelines to help and support what we should be doing for each individual patient or patient group. We have to be able to think critically why the evidence applies to a particular patient. So we have to be able to understand a whole host of evidence that is related to patients, their conditions. And we have to be able to examine that evidence to see, does it apply to this person? How does this person feel about this evidence? We have to think about this technical rationality. If the rule book says, in this situation you have to do that, how do we actually take another person's or the patient's beliefs, their understanding, their wants, their wishes into consideration when we're actually delivering evidence-based care? So that's where compassion is needed, because you have to understand what the patient needs, what's important to the patient. So seeing it from their point of view. So it's not just doing what you think they need, it's understanding what the patient thinks they need and reconciling that with the evidence base for that particular condition, that particular patient. So compassion is very much needed when we talk about competence and we're talking about the processes of delivering healthcare. We have to make sure that we understand body systems, we have to understand pharmacology, how medicines work, how procedures work, how symptoms from different conditions affect people, what the side effects of conditions are. And we need to be able to understand that from the person's perspective and actually help and support them through this process of technical rationality and the delivery of healthcare. So you can see compassion is something that's complex. We've only just touched on or scraped the surface of thinking about what compassion is. But think about how you can show compassion today, how you can actually start to think about what compassion means and how it actually helps and supports you in working with, being with the people who are important to you. If you can start with those people, then if you want to become a healthcare professional, it's helping you to think about this way in which we behave, our core values, so that when you do become a healthcare professional, you've got a basis to work from. I'll leave you with the words of the Dalai Lama. If you want to be happy, practice compassion. If you want to be happy, practice compassion. So over to you. Today you can start by practicing compassion. Start thinking about what this terminology means, particularly if you're applying for a health course. Think about what we mean by the 6 C's. What do we think about compassion, empathy? What are your qualities and values? What experiences have you got that you could use to demonstrate those qualities and values? Thank you for listening.
Hello and welcome to Bangor University. My name is Carol Westwell. I'm one of the adult nursing lecturers in the School of Healthcare. It can be said too often that hand washing is the most basic and important technique in preventing and controlling infections. It is the single most effective infection control measure. Hands are the most common vehicle of transmission of organisms. Hand washing is recognised as the single most important way to prevent the spread of infection. In this skill session, Naomi will demonstrate the principles and concepts surrounding hand washing.
So first of all, turn the tap on and wet hands. Apply soap, rubbing palms to palms. Then rub the backs of the hand with the other hand between the fingers, moving the ring at the same time. And then the other hand. And then palms to palms with fingers interlaced. Then interlock fingers. and then clean thumbs. Then fingertips to palms, and the other hand, and then clean wrists, and rinse, being careful not to touch the sink. Clean hands, dry hands, downwards, just patting, and the whole activity should take 40 to 60 seconds. You turn the tap off with the paper towel.